Would you mind to like and subscribe to keep it free for others? You too can send your results.
The question:
what is meant by erythrocyte sedimentation rate in my blood test results? And what does ESR test results mean?
Professional explanations. For ordinary people.
Results interpretation.
If your ESR is greater than 100 mm first hour, you may have an autoimmune disease. However, some of them and some cancers are the usual reasons for extremely high SED rate level. Autoimmune diseases such as systemic lupus erythematosus, rheumatoid arthritis, or inflammation of the thyroid gland, Graves' disease. Cancers, such as lymphoma or multiple myeloma. If you got moderate high ESR, around 50 mm per hour, at the beginning of the inflammation episode, the SED rate become mildly elevated, usually around 30 mm per hour. Then when the inflammation process is prolonged, the SED rate raised to become around 50 mm per hour, but SED rate become extremely high when the underlying reason of inflammation left untreated for a very long period of time. Below are some examples of reasons that cause mild to moderate increased SED rate levels. Such as any inflammatory disease taking long period of time in the heart, bones, kidneys, stomach, etc. Pregnancy and toxemia of pregnancy can cause moderate elevated ESR levels. Some diseases don't elevate ESR. 1. High blood sugar levels, the hyperglycemia. Unless the diabetes becomes a chronic disease, it wouldn't elevate the SED rate. 2. Polycythemia, a disease of increased red blood cells production. Although the RBC forms similar stages of ESR test measuring process, the SED rate does not show elevated or just increased slowly because the red cells that is under study by ESR test is defected. 3. Sickle cell disease, a defective disease of red blood cells that causing the RBC can't do its normal function, thus can't carry too much agents, and therefore the SED rates does not increase even the body is ill. 4. Severe liver disease, it doesn't elevate the SED rate unless it turns chronic. 5. Congestive heart failure, doesn't affect SED rate levels because doesn't cause too much inflammation at the beginning. 6. Neuritis, the inflammation of a nerve or the general inflammation of the peripheral nervous system. The interesting is that neuritis doesn't elevate SED rate levels. In the laboratory we can't find high SED rate for patients with nerves inflammations, although it's a chronic persistent illness. 7. Any acute illness, the diseases that occur during short period of time doesn't elevate the ESR reading.
Bloodtestsresults.com. Happy to help.